So at this point, really, there's kind of three major reasons that patients are going to be calling you, okay? We already covered cancellations and reschedules. That's definitely one reason patients are going to call you. Get as many reschedules as you can. Make sure that communication's high. We've looked at, dental pain, right? If somebody needs that help right now because they're in dental pain and they need help with that emergency, that is absolutely a reason they're going to be calling you right now. And the third one I would say is dental fear. Someone who is just like a nervous Nelly, something's going on in their mouth and they want to call in and figure out what's going on with that. Maybe you can help them with that. There's also people who are interested in higher value services like dental implants. They have always had a dental fear, right? They've always wanted to get something fixed, and now is just the time that they're going to be calling in. So we know that communication is absolutely essential. But when we're looking at people who don't need that emergency treatment right now, today, they're not necessarily looking to reschedule, they're looking for information, then I would highly encourage everyone to embrace teledental. This is going to be huge for building your foundation right now. And there's a couple of reasons why. First off, I want to talk about the ADA's policy on teledentistry. I think it's a pretty solid stance here. When we look at something like telehealth, the ADA is basically saying this is not a specific service, teledentistry, right? But it's a collection of means to enhance care and education delivery. So if we think about it in that way, we can really look to answer questions for patients and set ourselves up to grab market share and set ourselves up for success in the future. Additionally, with reimbursement, I'm not going to go through the whole paragraph here, but the point is that per the ADA, if you do charge for anything on teledentistry, that will be covered by insurance. So there is ways to make money doing this. You don't have to just completely work for free doing teledentistry, and patients can utilize their insurance. Now, one thing I want to cover before we get into some of the details here is that if you're thinking at this point, oh, teledental, I'm going to end up doing just all these consults for bad quality patients, I need you to get out of that mindset, okay? That is a victim mindset that you're having right now. Like, it's never going to get better. All of these are going to be bad quality patients. It's a victim mindset, okay? So as a fighter mindset, you want to think, I can make this work. I just need a little bit of help to figure out how do I make teledental work for my practice. That's the mindset we should be in right now. Okay. So as we're embracing teledental, the goal for your next 60 to 90 days is just get in front of patients. Okay. Absolutely get in front of as many of these patients as you can. There probably isn't going to be less dental care this year, or if there is less dental care this year, it won't be that much. It's just right now it's on pause. There's a huge pent up amount of demand right now. Okay. So you can use virtual consults to start stacking appointments. Okay. Get somebody who's got some questions or thinking about implants or want to try a new dentist. This is an opportunity for you to talk to them one-on-one between you as the dentist and that individual patient, and really build that relationship, build that trust with them, show them, yes, I can help you. I cannot do it right now because my office is closed, but I can get you in at this specific date. And we'll go into all the rest of the details then. But it builds that relationship, allows you to stack those appointments up so that when you open your practice up, you're going to be ready to go. You're absolutely ready to go, and you've got that patient flow. And it's a real simple process, teledental, okay? You have somebody call in, the staff takes the call like normal. They can book that virtual consult for a specific time on your calendar. Patient shows up for the virtual consult. It's just a screen share, right? But also these teledental softwares are set up to do things like automatic email and text reminders. So it's great for that. They can often take payments, do file sharing, and a lot more. So there are different softwares out there that are quite effective for teledentistry. And patients actually love virtual consults. We're seeing this more and more as dentists are embracing this. There's only been a few that have done this, but now it's definitely going to get bigger because there's no distractions. You give 100% of your attention to the patient. It leverages everybody's time. It's highly convenient. It's very, very personal as well. So again, opportunity to bolster that trust with any of the patients coming in or competitors' patients. I mean, it's as simple as like, I call up one practice and I get the answering machine, and then I call up your practice and I talk to the receptionist, and I'm actually booked with a one-on-one call with the doctor. That's awesome. That is awesome. And that's going to be a huge way for you to build your foundation right now. Okay. So we're looking at a couple things right now, just streamlining client websites so patients can either book an emergency appointment or set up a virtual consultation. Getting a simple lander up can do a lot of this right now on your website.